We are joined now by Congressman Steve Scalise. Thank you for joining us this afternoon.
Great being with you, Karen.
So it is May 1st. Ordinarily, this was the day they were supposed to lift the stay-at-home order. The governor decided to extend it. Some Republican lawmakers not thrilled with that. Are you comfortable with the pace at which the state is reopening the economy?
You know, look, I know the governor's looking at his protocols. I've talked to so many businesses and people that are just cooped up in their houses that recognize, look, we don't have a vaccine right now. There's a lot of great work being done to get a vaccine. And I think a lot of cures, I've talked to the heads of some of the major drug companies yesterday, and I think they're making breakthroughs at a revolutionary pace. But we also know when we do go out of our houses for the first time to just go back to some of the businesses we used to go to, this disease is going to still be around with us. So we've got to take precautions. We've got to be safer about doing things, social distancing and all the other precautions. And, that process has to start soon. And, if it's not going to be until the middle of the month, then at least let's start planning so that when the middle of the month happens, as many places can open as possible. Because, look, our economy is struggling. You've got now over 30 million Americans that are unemployed because of this. People need to get back to work safer. It's not a trade-off between safety and economic health, but we've got to do both, and we've got to do both as soon as possible. Recognizing this disease is going to be around. Hopefully by football season, we can go back into the Dome and go back to Tiger Stadium and be together in a big setting like that. But in the meantime, we want to go back to our restaurants, and it'll look different the first few weeks, but we need to start that process.
Okay, you're bringing up a lot of things I'd love to follow up on. And first of all, let's talk about those drug companies with whom you spoke yesterday. What are they telling you? What can you share with us?
Well, they're all at different stages of finding cures and vaccines for COVID-19. There's a lot of testing going on, and I've worked with the FDA. We've gotten the FDA to move at rapid speed to approve things like that Abbott test that you can now take. And, I was at the White House Friday with the president when we did the bill signing for the replenished Paycheck Protection Program. I had to take an Abbott test before I could meet with the president, and came out negative, luckily. But that test was literally, that testing process was approved by the FDA in days, just a few weeks, which would have normally taken 2 years. And so they are looking at things that are positive. They don't necessarily know they have a cure, but they're seeing things in testing that is very positive, and some very innovative things that are done. I'm encouraged by what I hear by these major drug companies. And when I talk to the heads of our local hospitals, the protocols that they're looking at and recommending businesses take to be able to open up safely. Things like temperature checks, where they put that little device in front of your head, and in 2 seconds, they know your temperature. And if you're over 100 degrees, you should be staying at home, getting better from whatever it is. Might not even be COVID, but those are the kind of things that people are looking at.
So are you hearing 18 months? I mean, that was sort of the figure we've heard for a while as far as how long it would take to get a real vaccine, an effective one, to the American people.
I think it could be sooner than that. And, look, nobody knows for certain, but the testing that's being done by some of the best medical minds in the world, they are all focused right now on understanding, which we're learning. It's amazing just how much we know today about COVID-19 that we didn't know just weeks ago. And so that science is advancing in real time. And so science is very important in this. Testing is going to be important. But ultimately, learning how to live with this disease in that interim period is important too. And we're learning even more about how many people. I mean, there was a really good study by Stanford University that came out just a few days ago that tells us a lot more about how many more people were exposed and probably were positive COVID, but just didn't have those bad symptoms and are now over it. Maybe they're immune to it. They're trying to figure that out right now. But we're learning all kinds of new things. But even Stanford was suggesting that people can start getting back out in the community, taking those extra precautions.
Well, that certainly sounds encouraging. You also mentioned earlier unemployment. Another 4 million Americans just this week filed for benefits. You have GE Tech pulling out of New Orleans. Those were people with high-paying jobs who are soon to be out of work. What can people expect from the federal government, if anything, moving forward? Is there a third round of stimulus?
Well, it's hard to say. We just passed last week the replenishment of the Paycheck Protection Program, and we were talking about a bill that is over $400 billion when you combine the PPP money for small businesses and workers, as well as we put an additional $75 billion for hospitals so that our frontline workers, the doctors and nurses, can get the testing and tools they need, and to get more help to our hospitals who are losing money. I mean, look, they're have been unable to do elective procedures on people. And by the way, that risks lives too. And by the way, the Stanford study references that the people that were not getting mammograms and colonoscopies to detect things earlier, to be able to save their lives earlier, weren't getting those procedures done for the last 6 weeks or so. And that needs to start up again as well. So, there's a lot that we're learning about this, but there's a recognition that the longer we stay closed, Karen, the more businesses we're going to see not only leave, but just fold. I've heard from so many small businesses that said they don't know if they're going to be able to make it back if this goes on for much longer. And so, I understand all the protocols, but when you can do things safely, you've got to recognize that the longer they stay closed, the fewer businesses will ever come back. And we don't want to see that in our economy or for families that are struggling already.
Oh, certainly no one does. Absolutely. It is May 1st, so this would ordinarily be the second week of Jazz Fest. It's canceled. And then you heard the mayor say that she didn't really want any festivals for the remainder of the year, and then Jazz Fest and Voodoo and others canceled subsequently. Your take on that?
Yeah, and I've talked to Mayor Cantrell, and we've had a good working relationship. And clearly, she's got other things that she's looking at too. But, the big question is going to be for any big events, and I've talked to people that do conventions all across the country, people that run some of the biggest sporting leagues that we all know very well. And they're all looking at protocols, not for next year, but how to, for example, go back to a Saints game safely, how to go to college football games, like going into Tiger Stadium on a Saturday night. I talked to Coach Ogeron. He doesn't want an empty stadium, but they're going to have to test the players clearly because of the physical contact. But even they are looking at and planning for protocols to have a full season where people can go to stadiums, and people are going to want to have a confidence. Do 75,000 people want to go to the Dome? I think by the time you get to September, there's going to be enough additional things that we've learned about this that people will want to go into the Superdome, knowing that things are going to be safer. They're going to take more precautions. But look, we can't just close everything down forever and think that there's going to be an economy to come back to. Suicide rates are higher. Suicides are up. You're seeing mental health illnesses rise dramatically right now too, because not only are people home, but they're losing everything they worked for in some cases. And we've got to look at all of that.
Absolutely. But back to the Saints, because that we can't get enough information about the Saints. Do you expect the Dome to be open for business?
Well, look, it's a goal of mine to see us at a place where we've gotten all of the protocols from the Centers for Disease Control on down to where you can see sports leagues not only having games again, so you don't have to watch replays of championship games from years ago, but you can actually watch a Pelicans game. Maybe there will be fans in the stands for Pelicans games. That might come a little later. But for football, absolutely, it has to be an objective that we all set and figure out how to make that a safe process. And and I've talked to people like Doug Thornton, who runs the Superdome, and so many other people that are looking at all these protocols. They're not going to do it if it's not safe. But we are learning so much more every day about how to keep people safe in settings today, maybe with your restaurant opening up at a smaller capacity, but ultimately where the restaurant can be at full capacity, where a shopping center can open again, and ultimately where these big venues, whether it's the convention center or the Superdome, can be open to pack houses again.
What about Mardi Gras 2021?
I still think we're at a pace where we surely shouldn't be shutting the door on anything like that, because again, there's so much today we know that we didn't know 2 weeks ago. So let's keep that as a goal, is to figure out how to put on a Mardi Gras with new safety enhancements. Maybe we have a vaccine by then. We have vaccines for the flu, yet people still die from the flu. But you take more precautions. Frankly, we should have been doing more things like washing our hands during an active flu season, and we weren't doing as much of that. We're doing that more now, and I think people will be a lot more aware of, if somebody around them is coughing, they're going to avoid that. You might not have done that as much just 6 months ago.
Okay. Final question. The Catholic Church plays a larger role in our city than in most. Our roots are in the Catholic Church here. Your reaction to the Archdiocese declaring bankruptcy?
Yeah, I was caught off guard when I had read that yesterday, and I haven't talked to the Archbishop, but I know they're trying to figure out the financial challenges, not only that they face today with churches closed and you don't have the normal church collections, but also some of the problems we saw before, and the abuses that had happened before that we all lament and just are so upset about, that clearly is weighing on them as well. I know there are other archdioceses around the country that have declared bankruptcy, and I would imagine, again, I haven't spoken directly to the Archbishop, but I would imagine they're looking at some of the same things that other archdioceses from around the country had used to file bankruptcy prior to all this.
All right. Is there anything I haven't thought to ask you that you'd want to make sure you conveyed?
Look, I mean, everybody's doing the best they can. There's always good signs you see out there in the middle of all these crises. We came through Katrina, we came through the BP oil spill. People pull together. It's tough. It's tougher for some people and others. Reach out to your friends. Friends that are struggling right now that maybe just got laid off or struggling to see if they're going to be able to keep their business afloat. And make sure you're talking to them, because we can't go and hug somebody right now in person yet. But we sure can get on the phone and do Skype or Zoom or some other way of reaching out to your friends. And to see that flyover today, by the way, wow, seeing those B-52s and F-15s flying over Oshner, that's what I saw, the thunder, just the feel of that. It just makes you proud to be an American. And we thank those frontline workers, our doctors and nurses and the others that are out there risking themselves to keep us safe.
And that is something everybody can agree on. Congressman Steve Scalise, thank you so much for joining us.
Karen, always great to be with you.
You too. Stay well.
You too.
Thanks.